tool for warts. A pumice stone soaking the feet is certainly a good thing to do as well. Prevention is key, though. Wearing flip-flops or sandals when you're in a public area, locker rooms, shower rooms, pools, is a good way to just prevent getting the virus in general.
So you definitely recommend the MacGyver treatment, the duct tape.
Yes, the duct tape MacGyver treatment.
You mentioned that some foot problems from swelling are permanent, but how are those treated? The ones that of the small group that look a little bit more serious, how do you diagnose those, and what kinds of treatments are available for those more serious ones?
Well, some women actually have pretty severe heel pain encountered during pregnancy, pain at the ball of the foot, different problems like that. Actually, corns can be quite painful as well. Heel pain, a good way to prevent that from its onset is to wear a very good supportive shoe with good arch support. Your arch needs to be supported during pregnancy. The center of gravity is changed due to the weight in the abdominal area. Thus, there is just more strain and pressure on the foot combined with the hormone that's released that causes the foot ligaments to loosen, and the foot is your foundation. If it's not healthy, you don't feel well. So a good supportive shoe is something that can prevent the heel pain. If heel pain is encountered, there are good stretching exercises that can be done. Usually a tight calf muscle could be responsible for heel pain. Certainly supporting the foot with the arch support, as I said. As far as pain in the ball of the foot, stretching is also appropriate for that. Wearing a supportive shoe is certainly important and can prevent that from happening. I generally don't recommend high heels for any of my patients. They're not very good for your feet, but certainly not something that a pregnant woman should wear, because the center of gravity has changed, and then putting a 3-inch heel behind you, that's not good for your back or your knees or your hips or your feet. And it can lead to more frequent falls or injuries as well.
Do you often find that you're for pregnant women that were active or are active?
Yes.
Are there certain exercises that you caution them to stay away from, or are there exercises that you actually encourage them to do to stay active and help avoid these kinds of problems too? Well,
first off, I think pregnancy is not a time to start up a new exercise program. If you weren't a runner, don't start running when you're pregnant. If you weren't playing tennis, don't start when you're pregnant. Yoga, though, is one exercise or program that I think is very beneficial for all pregnant women, and actually can help ease the woman through childbirth. There are a lot of the problems that are encountered during pregnancy, including arch pain, heel pain, low back pain, can be avoided by participating in yoga, and many hospitals actually offer yoga as part of their prenatal treatment.
And a foot-friendly sort of exercise too. There's
not a lot
of pounding and repetition on the foot.
Exactly. It's not a load-bearing exercise. Anything where the mother is going to be on her back is something you should avoid in terms of exercises, though.
Now, plantar fasciitis, for instance, is a very common repetitive disorder, a swelling of that tendon. Do you see that more or less likely in pregnant women?
Definitely see plantar fasciitis more. Actually, I think plantar fasciitis or heel pain is the #1 diagnosis that most podiatrists encounter, but as far as pregnant women go, it's even higher. There's added weight, there's the ligaments loosening, everything sort of leads towards plantar fasciitis, unfortunately. The foot starts to flatten, which puts strain on the plantar fascia, which is a ligament on the bottom of the foot. It doesn't like to be strained.
I'll put up the little model here.
So this is our foot model. This is the heel bone, which is known as the calcaneus. The plantar fascia originates here and extends all the way to the forefoot. And what happens when a woman is pregnant, as these ligaments loosen, the foot starts to flatten, the plantar fascia doesn't stretch. So it literally starts to pull off of the heel bone, which is very painful. Usually symptoms are most prevalent first thing in the morning. When the patient's sleeping, the arch is generally a little bit increased. And when that first step is taken in the morning, it literally rips off of the heel bone. So it's nothing to poo-poo. It's a very serious problem and should be treated.
So in addition to morning sickness, a pregnant woman might also have to deal with this too.
Absolutely.
Quite a bag of tricks we've got for them. talk a little bit more about some of the more common issues that the women, pregnant women that you've treated, seem to be telling you about their feet. You said that at certain times of the day is when a woman experiences foot pain is a crucial question. If they're having foot pain early in the day, for instance, what does that mean versus the end of the day, for instance?
Well, it's also dependent on the body part. Heel pain early in the morning when walking is first initiated is pretty common. As far as swelling, if the swelling is very aggressive or very pronounced first thing in the morning, that's not very typical. Usually swelling is after someone's been on their feet all day. Things like corns and ingrown nails are typically more bothersome towards the end of the day. Everyone's feet swell throughout the day, especially a pregnant woman, and any additional fluid within the foot will put increased pressure on corns and ingrown nails, especially if the shoe isn't fitted very properly.
Now, my wife gets regular manicures and pedicures, and a lot of women get that done nowadays. When you're pregnant, what kinds of issues should a woman be concerned about when they're getting a pedicure? Is this a time to do it more often, less often? Is this a good time to pamper yourself, for instance?
Absolutely. I think pampering is very appropriate during this time period, and I think most partners would agree with that. For any patient who's having a pedicure, I usually recommend bringing your own set of instruments, and that's just a good idea due to the hygiene. If you're very comfortable with the salon and you know that the salon is sterilizing the instruments properly, then that's not as big of a concern. I also recommend bringing your own nail polish. If you think about it, if someone before you had an infection and the nail polish is being used on you, the nail polish inherently does have components to it that kill most bacteria and fungi, but if you're immediately following someone else with a fungal infection, that's not something you'd like. Another important thing as far as pedicures go is there's usually a tendency for some of the people who work at the salon to cut the cuticle. Your cuticle is a natural barrier, and while it might be unsightly when you're trying to get that perfect French manicure, it's not a good idea to remove the cuticle. It's more important to actually have the cuticle pushed back. That's a better way to deal with it. As far as patients who have other health problems, not that pregnancy is a health problem, but if it's a pregnant woman who actually has diabetes or gestational diabetes, I generally recommend avoiding pedicures. That's probably something you should avoid because you could be more susceptible to infections from that. The soaks that you typically have prior to a pedicure, I don't know if you've had one before.
Not recently, no.
But
it's been a while, a couple weeks.
These soaks are fine for someone who doesn't have something such as diabetes or circulation problems, but they're not a good idea for those patients because the water actually serves as an astringent, and as you would think that water would moisturize your feet, but it actually dries the skin out more, which can lead to cracking, especially with this winter we've been having.
Right. Yeah. Now, gestational diabetes is a real problem for pregnant women, too. Aren't they at a higher risk for this kind of problem?
Absolutely.
And how do you treat those? How do you diagnose those women and look for those kinds of signs?
Some of the signs of gestational diabetes or women who are at risk for gestational diabetes are women who have pregnancy when they had a very large baby. So I think the number is over 9 pounds.
Great. We do have our first caller of the night. Welcome to Feet Forward. What's your question?
Hello. Thank you so much for giving us information. My daughter has a very, very, very flat foot. And I'm wondering, will that cause any problems in her future? Should there be something I should be inserting into her shoes to encourage